Welcome back, our fans. Classification of periodontal conditions. Different classification systems for periodontal diseases. 1. Armitage Classification 1999, 8 categories. 2. New Classification 2017, 4 categories. Rationale for new classification. 1. To create a simple classification system that could be implemented in general dental practice. 2. To create a system that accounts for both current periodontal status, assessed by staging periodontal disease, and future susceptibility to periodontal disease, assessed by grading periodontal disease. 3. To create a system that takes into account treatment planning customized to individual patient scenarios. 4. To create a live/dynamic system that can accommodate regular updates. Differences between Armitage and new classification. 1. For the first time, the new classification system defines periodontal health and gingivitis for patient with an intact periodontium, a reduced periodontium due to causes other than periodontitis, a reduced periodontium due to periodontitis. 2. Chronic and aggressive periodontitis terminologies have been removed. They are now thought to be variations of the same disease process. 3. A major change has occurred in the classification of mucogingival deformities and conditions. 4. A classification category for peri-implant diseases and conditions has been included for the first time in a periodontal classification system. Periodontal health, gingival diseases and conditions, first category. 1. Periodontal and gingival health. Intact periodontium. Reduced periodontium. 2. Gingivitis, dental biofilm induced. Dental biofilm induced. Systemic and local risk mediated. Drug-induced G enlargement. 3. Gingival diseases, non-plaque induced. Genetic. Infectious. Inflammatory. Reactive. Neoplasm. Endocrine. Traumatic. Gingival pigmentation. Periodontal and gingival health. Pristine gingival health defined as total absence of clinical inflammation and physiological immunological response. It is unlikely to be observed clinically. Clinical gingival health, associated with a biological inflammatory infiltrate and a host response consistent with gingival health. Intact periodontium, absence of detectable attachment and bone loss. Reduced periodontium in periodontitis patients. Patient attains stable state after successful treatment, treated sites. It is associated with risk for progression, so need close monitoring to prevent the recurrence. Reduced periodontium in non-periodontitis patients, as in gingival recession and crown lengthening. No accurate proof for recurrence. Clinical health on intact periodontium. Characterized by absence of bleeding on probing, erythema, edema, and patient symptoms. No attachment and bone loss. Gingival health on reduced periodontium. Characterized by absence of bleeding on probing, erythema, edema, and patient symptoms. Presence of attachment and bone loss. Gingivitis. Dental biofilm induced gingivitis. It is an inflammatory response that localized to the gingiva tissue in the absence of attachment loss, as a consequence of sustained dental plaque bacterial biofilm accumulation located at an apical, below the gingival margin. Classification. Based on 1. Extent. 2. Severity. 3. Location. 4. Causative and modifying factors. 5. Plaque-induced gingival inflammation occurs on an intact or reduced periodontium. 1. Extent. Localized, when less than 30% of teeth are affected. Generalized. When greater than 30% of teeth are affected. 2. Severity. Mild gingivitis, minor change in color and texture. Moderate gingivitis, erythema, edema, enlargement and bleeding on probing, BOP, seen. Severe gingivitis, overt erythema and edema with tendency to bleed when touched rather than only when probed. 3. Location. Marginal gingivitis, involves the gingival margin. Papillary gingivitis, involves the interdental papillae, often extends into the adjacent portion of the gingival margin. Diffuse gingivitis, affects the gingival margin, the attached gingiva, and the interdental papillae. 4. Causative and modifying factors. 1. Associated with bacterial dental biofilm only. 2. Potential modifying factors of plaque-induced gingivitis. Systemic conditions. A. Sex steroid hormones, puberty, menstrual cycle, pregnancy, oral contraceptives. B. Hyperglycemia. C. Leukemia. D. Smoking. E. Malnutrition. Oral factors enhancing plaque accumulation. A. Prominent subgingival restoration margins. B. Hyposalivation. Other local plaque retentive factors. Antiepileptic drugs, phenytoin. Calcium channel blockers, nifedipine. 3. Drug-influenced gingival enlargements. E.g., calculus, orthodontic brackets, overhanging margins can also influence plaque accumulation. 5. Occurs on an intact or reduced periodontium. 1. Gingivitis on intact periodontium. 2. Gingivitis on reduced periodontium and non-periodontitis, GR/CL. 3. Gingivitis on reduced periodontium and periodontitis. A patient with intact periodontium would be diagnosed as a GC according to a BOP score greater than or equal to 10%. Further classified as localized BOP score greater than or equal to 10% and less than or equal to 30%. Or generalized BOP score greater than 30%. A patient presenting with a BOP score less than 10% without attachment loss and radiographic bottle loss intact periodontium is considered as clinically periodontal healthy. Incipient gingivitis, a condition defined as being characterized by only ophthalmitis being affected by mild inflammation and mild erythema, and or displaying otolate and broken linear of bleeding regarded as a condition of clinical health, my rapidly progressed to localized gingivitis of left treated. Symptoms. Slight discomfort and soreness of gingiva especially during brushing. Unpleasant taste sensation and halitosis. Thanks for watching, support us by likes and subscribes.